We'll go ahead and get started. I know your husband's getting some coffee. Thank you all for coming this morning. As we were talking, I think right before you came in, 8 o'clock is, a little bit difficult to get to some mornings, so I appreciate the time that you took to come. This is the beginning of a 6-part series on caring for elderly parents. This first topic is called Choosing the Right Care. I'm going to talk about place and people for choosing the right care. A lot of the next 5 sessions have overlaps, and so just to put it in perspective, next week the series is going to be specifically on Alzheimer's care. So of course, when you have somebody that you're caring for, you want to choose the right place and the right people to care for somebody with Alzheimer's, but there are very specific needs for that. So Dr. James Smith will be teaching that. And he's excellent, and that's an excellent program. I think the week after that is signs and symptoms and things to look out for in dealing with elderly parents. But I think Brenda Popp is going to be doing that one. Then I'll be back for class session number 4, which is on siblings, self, and finances. When you're caring for elderly parents, there are your parents' siblings perhaps, or your own siblings perhaps, that you have to interact with, deal with, and work out the care plan together with. Of course, taking care of yourself is extremely important when you're a caregiver, and finances are always something you have to be very aware of and what you can do with that. Class 5 is more of a legal issues, dealing with wills, legal issues, and the 5 wishes. And even if you don't have to worry about the legal matters for your parents, come for yourself. 5 wishes. Everybody should complete the 5 wishes. And then the last class is going to be focused purely on hospice. So, a little bit about myself. My name is Cindy Lavoie, and I'd like to take a moment to introduce my husband as well. This is Paul Lavoie. I have the background in caregiving from 2 perspectives. I have been a caregiver for my personal family members, and extended family members 6 different times in my life thus far. But I also own a home health care agency, full disclosure. So I've seen care delivery from the perspectives of many, many families over the past 26 years in that line of business. And no caregiving situation is the same. And it affects people differently. Patients handle it differently. It really is something that is very unique each and every time you have a caregiving incident. So when you think of caregiving in a broad perspective and being a caregiver, what comes to mind as far as a caregiver? For me, it's this person, St. Teresa of Calcutta. To me, she's the epitome of caregivers and caregiving. But why? Why does, we know of her selfless works, of course, but she cared for people she didn't even know, people she didn't love. But I guess that's the key. She did love them. When we care for our family members, especially our elderly parents, they're our parents. We love them, or we hate them, or we love and hate them, different times of our life. But Mother Teresa, St. Teresa, did everything out of love, for the love of God. And that's what made her an exceptional caregiver, is because if you can do the caregiving you do, not only because of your love for that person, but because of the love of God that you can show, that transcends everything. That's why I believe, of course, she was such a great caregiver. And this quote I like, that she said, "At the hour of death, when we come face to face with God, we are going to be judged on love, not how much we've done, but how much love we put into the doing." It makes a lot of difference when you're a caregiver and you're tried and you're tested and you're frustrated, that you can remember that. Okay, next slide, honey. Next, please. Dr. Paul Wright did a presentation at a conference called Aging with Purpose and Passion. It was in June 2011. It was a conference at Holy Cross College at Notre Dame. And just a little bit of background on Dr. Paul Wright. He was Mother Teresa's cardiologist for about the last decade of her life. He was a very successful cardiologist, fairly young. He wasn't, hadn't been in practice, 50 years, but he realized at a younger age that this is great, I'm doing a great job, I'm successful, but there's got to be more. And so he hooked up with Mother Teresa down the line and just had the best experiences of his life. He has a book. You can, look at that separately if you'd like. But at that conference, these were the key points of his presentation when he was trying to share Mother Teresa's message specifically to caregivers as he carried that on. The first point, our society values youth, wealth, security, and power, but the true greatest value comes through serving others with compassion and love. And you can read that, and yes, it sounds good, but when you experience it as a caregiver, you realize why you're doing it. And you realize that a lot of those other things really don't matter. And Mother Teresa nailed that one, I think, right on the head. We're not all called to serve in the same way, but we are each called to serve through compassion and love in our own way. Not everybody can be the caregiver like Mother Teresa, who can pick a dying person up off the street and take them, to her home for the ill and sit side by side with them. But whatever you can do, no matter how big or how small, that's what matters. And Mother Teresa declared that the most painful suffering of all is loneliness. Matter of fact, that's how her work started. She felt nobody should die alone, especially the people that were dying in the streets in India. And sometimes loneliness is the greatest thing in caregiving to overcome. And Mother said, don't ever forget who you are touching. It's obvious that when you're providing care and you're a caregiver, especially to your parents, that you're touching them. But there's so many more people that you don't realize that you're touching when you're just talking to people about being a caregiver. You don't know what their experiences are as a caregiver, if they've ever had one. And you are touching so much more than just the person you're caring for, and of course yourself. Okay. Do you have any feedback on Mother Teresa? Any thoughts on Mother Teresa as a caregiver? St. Teresa, I'm going to never get used to that. I know, St. Teresa.
Saying that she was like the extreme example.
Yeah.
That's why she's saying.
Yeah, that is one of many reasons. All right, so let's get on with a little bit about talking about providing, care, first of all. This is going to be a little bit of the academic portion. My background professionally in business is home care, but also personally as a caregiver. So we're going to go through some terminology, different places that you can provide care, the definitions, and home care, of course, which is near and dear to me. But before we talk about those places, we need to talk a little bit first about how you become a caregiver. For a lot of people, it's planned. You're going to be the one to care for your parents because you just have. You've talked to them about it. Your parents have talked to you about it. That discussion's been there. And you're going to be the one to care for your parents. Or you don't. That's the next way you become a caregiver. A sudden emergent crisis, some fortuitous event happens, and here you are, stuck in the middle, not knowing what to do because you haven't talked about it, you aren't aware of everything that you have available to you. That's the second way you become a caregiver. The third way that most people become caregivers is through family initiation. You or your siblings kind of realize mom and dad or mom or dad are declining, need a little bit of help. Let's start to talk about it, and we think she needs help. Parents may not feel the same. And then the fourth and final way is your parents initiate it. They may say, I can't do this anymore. I need some help. And then it starts the discussion that way. So I want a little bit about how, I guess, you are a caregiver, you've been a caregiver, you may have to be a caregiver. What did you, I know your sister.
Mom,
yeah.
in light of the fact that my brothers are totally out of the picture and my sister died on me. Right. So you are a caregiver right now, yes,
caring for your mother, and you have siblings that are not local, not involved in the care.
Want nothing to do with it.
Want nothing to do with it.
No, they are local, one of them, and
Yeah.
just absolutely nothing to do with it.
It's squarely here on your shoulders. Mm-hmm. Nobody else is, right.
Me, myself, and Susan and Sue.
Yeah. And you have a husband who immense support, as I can attest to. And what's your situation?
Yeah, well, I was going to ask you, like, the definition of caregiver is actually the one-on-one, like you're living with a person, or is it more that you're oversee, because I'll tell you my situation. Like, okay, I have my mother-in-law, my husband's mother, lives at Westminster Oaks. My husband is an only child, so by default, he's the one, and I'm the only woman involved.
Right.
So, a lot of things like, okay, picking out clothes and this and that. But my husband, handles all her finances, which is quite it's quite tricky to get help for her. You know what I mean? It's like you got to do the red tape for all these organizations and all this. But she's and I can't say more for Westminster Oaks. They do a lovely job for her.
Yeah.
Taking care of her and all that. But, there's still a lot of involvement. Is getting visiting and doing things and all that kind of stuff. And then I also have my parents, and I'm one of 4 daughters, and the one I'm number 2, so I'm one of the middle children. But the other middle child, third one, is one who is actually doing the day-to-day taking care of them. But my parents are like fabulous. They're in their 80s, but
yeah, and they don't need any care right now.
My dad is going through chemotherapy now, but he's like, okay, after a few days of the chemotherapy, after it wears off, because they do it like in 3-week increments, he's like exercising, and and they were telling him, well, you can only do 6 because of your age, and now that he's done 5, he's about to do a 6 in a couple of weeks. They're saying, well, maybe you can do 10.
Because he's responding and acting
but
so well.
My sister, she doesn't have any children, and she's like on her 3rd marriage, so it's sort of like a situation where she needs them and they need her, and they contribute to her support, not necessarily monetarily, but as far as giving her a house, and she'll inherit their house after they're gone, and they provide a car for her. And she does have a husband and stepchildren. So that's a situation. But it's kind of like the situation where it's like our other sisters try to, help, but she says, well, I'm doing it, and it's all like my parents. So it's sort of like we have to wedge in some ideas, but my parents are still, responsive to that.
Is everybody local or somewhere out of town?
No, they're about 3 hours from me, and about 2.5 from my older sister, and then the youngest sister is maybe about 30 minutes away.
Okay. So
and I have a 7-year-old special needs child.
So you have a lot of other caregiving duties. Number one.
So my older sister is like always saying, if you need a break, please, let me come. But unfortunately, the one that's offering the break, or the one that has the most conflict with
That has a lot of other things to tend to as well.
It's a lot of dynamics when you get a lot of siblings involved.
Yeah.
Sometimes it's better to have siblings, and other times
It's
not.
I see both sides, because my husband's an only child, so it's like totally.
That's where I'm at.
But
right now.
then you don't have the conflict. It's like you need to do something, you do it. You don't have to get a committee together.
And good morning. Are you
Good morning.
Are you in a caregiving situation? Potentially have one down the road?
Potentially, yes. I have elderly parents, both still around, both still living in a 2-story home. Mom is the provider for Dad.
Okay.
And they're both in their 80s. My father has Parkinson's disease progressing and diabetes. And my mom is frail and little, and it doesn't care to eat all that much, and she's taking care of him. The other day, he fell and into the couch, right? So he's face down into the couch, and she calls me all frantic, and it took me, as big as I might be, just everything I could to get him up. I pulled him back up. It was literally an hour and a half. I was sweating all over. He was sweating all over. So these things are occurring now where it's a challenge. He is very stubborn and does not want to leave. And my mom, who's been a caregiver her whole life, she cared for her brother who was ill. Her father, who had Alzheimer's, both, of course, passed away. And so she's just been a natural caregiver, a teacher, you know, and she obviously wants to stick around as long as she can. The family, and my brother, who's 10 years older than I am, has kind of pretty much removed himself from all caregiving. He'll offer advice over the phone, but that's about it. And he comes to visit once a week. We're all local.
Okay.
I do what I can to keep their house up as far as cutting the grass and, you know, just general picking up, cleaning up where I can, cooking every so often. They enjoy that. Talk to them every day. They live literally down the street from us, so well, we are close in that respect. But it's a challenge for me and for, you know, our family to get Dad into an assisted living type facility. Mom's on board with it, but Dad does not want to leave his house.
Right. Right.
And
Very
he
common.
had to. He's been forced to a couple times. A knee operation sent him loopy back in 2014. But he went to a local facility, and they rehabilitated him enough to where he could get back home. But it's a 2-story house, and they've got stairs everywhere, and it's got this chairlift. We put a chairlift in.
That's
We're just
good.
trying to accommodate the best we can for him, but he's becoming over the years less and less mobile.
Right.
So
right.
we're just having a hard time broaching that topic. Hey, you can't stay here. So I've told him lots of times, I said, listen, you stay here, you're running the risk of something bad happening.
Right.
And my brother has too. As long as you know that, we're okay with it. But something bad is going to happen. It's inevitable.
Right.
So and it's just we're having a hard time broaching that topic with them.
So you're in the stage of trying to mitigate potential
Disaster.
Yeah, exactly,
And it's not
disasters.
a monetary issue. They've got tons of money. It's just he doesn't want to leave that security of his
home.
Killarney Estates home.
Yeah, yeah, yeah. Well, we're going to talk about some of the different places where they can go. You've already done some legwork, talked to assisted living facilities, or have him on
He's
board
had
with
care there.
that, yeah, and he's received care there. Well, my caregiving situations, just to give you the personal ones, not the ones that as my business I've seen, but 25 years ago was my first time as a caregiver. My mother-in-law at that time had lung cancer spread to her brain. She came to live with us. We had some home care help, and then we had hospice. So that was my first involvement. Then 21 years ago, my 85-year-old godmother, who lived in Pittsburgh, Pennsylvania, with the ice and the snow, got to be a little too much for her. So invited her to move down to Tallahassee. Started off, she was very independent, and then, you know, she declined just with frail health and some health issues, and she moved in with us, and we did some care there. Then she moved to an adult congregate living facility. And then she ended up having a hospitalization and then passed away from there. Then my mother, in 2008, went in to the hospital for, a procedure that she needed and had some other serious health issues and ended up not coming out. But even though that was a caregiving situation where I was by her bedside in the hospital, you're still providing care even though you have nurses all around you in intensive care or whatever. So that's another type of caregiving. You're a caregiver for those around you as well. Year after that, her mother, who she was a caregiver for, my grandmother, I shared the caregiving duties with my aunt. My grandmother had dementia, and that was a situation where for a period of about 8 months, my aunt lived with my grandmother in her home for 3 weeks a month, and I would come down and do the 4th week a month as her dementia needs increased or presented more challenging situations. Then she went to an Alzheimer's type care facility, which we moved her here to Tallahassee so that I could be nearby. My aunt lived in Atlanta, so that was working out caregiving situations with other people. And then my father, who had been battling different forms of cancers, he finally came to live with me and my husband, of course, for about 2 years before he passed away. We had a lot of family support. I am one of 5 siblings, and then we had hospice in the end. And at the same time, when my father was living with us, then my son, this is not an elderly parent situation, but my son was in a serious car accident, and he had to come live in our living room after intensive care and rehab while he was recovering, because obviously our other downstairs bedroom, my father was there. My son, in his completely left broken side of his body, couldn't walk up and negotiate stairs like you were saying. So I've seen caregiving from a number of different perspectives, those that have involved family, those that have involved multiple types of care. So not only is it my business, but it's my heart too. So everybody's story, as I said earlier, is unique. Your caregiving situation is unique. When you're in it, you feel like you're the only one in it, but you need to know there's lots of things you can do to get help and support. Even though it may not be direct support with someone in and coming providing care at certain times, but there's certain things you need to do for yourself. That's a topic in week, I think, 4 that will be broached upon deeply. So let's talk about a couple of the care places, starting, of course, with home care. These are definitions from ACA, our state regulatory body that oversees all of the facilities and home care. So there's 4 different types of services. There's a home health agency. Home health agencies provide skilled care, and these are terminology that if you're not used to it, that's why I'm just kind of warming you up to it so that you may hear it in your caregiving continuum. Skilled care refers to nurses, registered nurses or LPNs that may provide services, as well as therapists. You'll have your physical therapist, speech therapist, occupational therapy, and medical social workers. So a home health agency can provide both the skilled and the unskilled care. You'll also hear it referred to as paraprofessional. Those services are those of a home health aide that can provide hands-on bathing, grooming, activities of daily living. And they also provide homemakers and companion services. Hospice is another arm in home care. Of course, we're going to have a whole week devoted to hospice, the last week in this series. But hospice services, they have the continuum of palliative and supportive care, primarily for the terminally ill patient. But terminally ill doesn't mean at death's door. Typically, it's a 2-year window is what the hospice definition used to be, but now there are some programs where you can have years of hospice care. Mildly, I say the amount of care you receive isn't as great as you would see later in the 2-year state, but you'll get a lot of information on hospice in week 6. A nurse registry is an agency. They can provide you with people to provide some of the care, but they do it through a contractual basis. They're basically like a broker for people to come to your home. And they're not always direct employees, so you have some things to be concerned about as far as taxes and insurances of the caregivers coming into your home. But they are licensed by the state of Florida. There are some agencies or home care groups that provide just the homemaker and companion services. So if you need, or your parent needs just help with laundry or errands or grocery shopping, you can call one of these type of agencies. There's a lot of them in town. You can go to their national websites. The thing to be mindful of is the situation of your parent. Will it deteriorate to where they need another level of care, and then you have to change agencies or companies that you're working with, which could be disruptive to your parent at whatever point in time. And then a home medical equipment provider, you'll also hear them referred to as DME, durable medical equipment. They're in the home care arena because they provide all the equipment that a parent may need, depending on their condition: walkers, wheelchairs, hospital beds, oxygen. So when you hear the lingo DME, that's what they're referring to. Again, we'll go to the next slide. A little bit about home care. Going to take a quick little quiz here on your home care IQ, just because this is my forte here. These are true or false. So the first question: home care is only for the elderly or the truly sick who have been hospitalized. Who believes that's true? Who believes that's false? Yay, you guys are correct. It is a false statement, of course. We talked about, you can have at the level of somebody who just needs a little bit of help with errands, and that's home care. So that is a false question. Question number 2, 60% of people age 75 and older will need some form of long-term care. Who believes that's true? Anybody believe it's false? It's true. 60% is about this statistic, and again, these are based on 2013 statistics, so, could be a little higher now. So, yeah, Helen, as you're thinking. We've got 2 more questions on the next slide. Oh, okay. You already did it. I'm sorry. Yeah, ahead of me. All right, so next question. 10% of the nation's elderly population have some form of disability for which they require assistance, like bathing, dressing, eating. Who believes that's true?
I think it's higher.
Half and half?
Yeah.
It's false because it's higher. Yeah, exactly. So if you think of our elderly population, right now that statistic is at 25%. That was in 2013. And with the aging population, maybe a little bit higher this exact point in time. And the last question, helping elderly relatives with just one simple task per day, such as eating or dressing, can take up to 9 hours a week. And that's for just doing, one task. Everybody believe that's true? That is definitely true, yeah. And that's just one task. If you have somebody with more complex care needs, you can see how the hours multiply and the need multiplies. So, okay, moving on. The biggest question, the most important question everybody always assumes is Medicare is going to cover it. Medicare is going to take care of my parent and help me pay for the stuff that I need to pay for to care for them. And that's really not true to an extent. Medicare does provide a benefit for home care, but to know kind of ahead what Medicare is going to cover, first of all, you have to meet some requirements to even receive Medicare services at home. The main 4 being the person has to be homebound. They can't be out and able to go grocery shopping and going, to church every week and going out and getting their hair done. That's not considered homebound. It has to be with great difficulty and assistance to leave the home. A physician has to order the care. So you have to have a physician say, you need this care. It has to be in a form of an order, which, your hospitals or your physician offices, take care of that. But you do have to have a physician's order for some type of care, and it has to be skilled care. The doctor can't just say, oh, you need somebody to just supervise you at home and help you with meals, because that's on the not covered by Medicare. You have to have skilled care, which is the services of a nurse or therapist. One of them needs to be coming to your home, and then Medicare will provide a home health aide to help with some bathing and dressing, but they don't do it continuously. It's in the corner here. All care has to be provided in visits. So they will come out and visit for maybe an hour, 2 hours at the very most to provide that care, and it's limited in duration. A couple times a week, and there has to be an end in sight, so over the period of 2 months or 3 months. And the last requirement is, we talked about, it has to be by a professional, meaning a skilled nurse or physical therapist providing some type of service. The services that they do cover and don't cover, on the skilled side, a nurse can come out and do injections, they can do wound care, they can do IV therapy. Therapists can come out and provide some rehab services at home. Help with strength training if you've had a hospitalization for a long time or a rehab stay where you're still kind of weak. Therapy can come out and do that. What they don't cover, and it's the things that everybody wants covered, is 24-hour care. They don't pay for any delivered meals at home. A lot of people think that that's covered. And they don't pay for any type of homemaker services. Again, those are cooking, cleaning, preparing meals, and that's what Medicare doesn't cover. So a lot of people are kind of surprised when they find themselves in that situation to be a caregiver that these things are not covered by Medicare. So, okay. We talked about home care. These are just some of the types of facilities that are available, licensed by the state of Florida, where you can also seek care for your parents. The first is an adult daycare center. Pretty much just as it sounds. It provides daycare where you go drop your loved one off at a certain time and pick them up at a certain time. So you may be able to provide for them in the evening, or they may be okay in their own home if they have somebody else at night, but during the day they need that supervision. They do have to have the requirement, they have to have some mobility. They can't be completely immobile. Continence is an issue. They can be incontinent if they're able to take care of it themselves, through use of Depends or something else. The catheters is another situation. A lot of daycare centers don't allow those. So you also have adult family care homes. This is an actual residential facility, like your own personal home, where you can have up to 5 people. The owner of the home must be unrelated to the people that are there. So if you have a parent that this may be a better situation for them, usually there's a disability involved. An adult family care home may be an option. Assisted living facilities are one of the most common. You've already mentioned an assisted living facility for your father. There are a number of them, and we have 2 new ones that are going to be opening up over the course of the next year here in our town. They provide full-time living arrangements. They provide meals. It's the most home-like setting, the housing. They, again, are licensed by the state of Florida. There are certain bed types within an assisted living facility. Assisted living facilities don't have nursing on staff 24 hours a day. So that is going to limit the type of resident that can live there. You may be living in an assisted living facility. Your needs increase as your healthcare issues deteriorate, and you can't stay in an assisted living facility any longer. Something to consider when you're looking at, where your parents are going to end up, unless they have an ECC bed, which Westminster Oaks has ECC beds and sheltered beds. So they have a special license that will allow them to keep patients who need more care and help with bathing and dressing.
Yeah, they have a health center too.
Yeah, and
Which is all that, yeah.
Westminster's an excellent place if you want to go from start to finish in your continuum of care, because they have.
And there are people that I've known that have been in assisted living and had a setback, a stroke or something, go into the health center and then go back.
Yes.
I mean, not,
because
most of them don't, but I have known some that have done that.
Within the Westminster community.
Right.
Right, and Westminster is, if we go to the next slide, Westminster is a CCRC. It's a continuing care retirement center, which covers all levels of care. So at Westminster Oaks, you can go buy a residential home that you live in, with your spouse or by yourself, and it is just a home situation. They have a health center, which has an assisted living facility. Then they also have skilled nursing beds, which are called sheltered beds. They can have sheltered beds because of their licensing. Then you don't have to leave the Westminster facility ever in your continuum of care as your needs increase and you may deteriorate in the level of care that's needed. So that's a CCRC. They're pretty pricey too, so it's a lot of people aren't able to go to a community like that. But it's very good in that you're self-contained and you never have to leave that retirement community again.
Yeah, it's good to talk to her, because we thought she couldn't afford it either, because that's a word on the street. Oh, you can't afford it. It's like, what? And I'm like, well, let's just go talk to him.
Yeah.
And lo and behold, she was accepted.
That's the purpose of starting these discussions today,
Yeah.
because what you think may not be. So go out and do your homework now before you are in a crisis situation. Talk to some of these places, and this is to get the dialogue going, and you may be surprised exactly with that.
And they have rehabilitative care also, so you can, it sort of kind of works like a Health South too.
Yes.
And the times that she's had to go in the hospital, then she gets Medicare, and so it's basically, she doesn't have to pay for her room and board, it's paid for because she should be in.
It's a
Health
Medicare
South.
bed,
Yeah.
right,
Yeah.
Medicare bed, yeah. It is a full continuum of care in a CCRC, so definitely. Nursing homes, you all have heard of nursing homes. You may also hear them referred to as SNFs, skilled nursing facility. So if you ever hear the lingo that you're going to a nursing home, or we're calling a SNF, that's kind of the lingo there. And nursing homes have different types of bed. They have community beds, they have private beds, they have room sharing, and then sheltered beds are, as we said, within a CCRC. That's how they have the nursing home, type of bed in like a Westminster, so you don't ever have to leave. Some nursing homes have special services within them, like an adult daycare. You may be able to drop a parent off there to have adult daycare at a nursing home. So there are other services within nursing homes. Respite care, I see this happen frequently where you're a caregiver, you need to go away for a week to a family wedding, but you can't bring mom or dad because their care is too comprehensive. You can seek respite care and just go for 2 weeks or a week and get that relief and know that there's somebody right there caring all the time for their needs. Alzheimer's care, there's a lot of facilities that just provide Alzheimer's care. You'll hear about that next week. And then there's higher levels of care. You have to, if somebody's dependent on a ventilator, someone has a tracheostomy, or somebody needs dialysis. There are freestanding dialysis centers, but you can also have dialysis within a skilled nursing facility. Some have pet therapy. Some have 24-hour coverage. Eden Alternative, we don't have any facilities in Tallahassee that have the Eden Alternative, which is kind of a growing movement, started about 12 years ago, and it's a person-centered approach in a nursing home rather than facility-directed care, if I'm describing this right. In Mariana, there's a facility that is the Eden Alternative. It's a type of care within a nursing home so that, the stereotypical nursing home is patients in bed and the nurse just comes in and out and brings stuff. So this is the reverse of that care. It's centered around the person. If that, you can look it up if you're interested in more. But we don't have any facilities in town that are certified as Eden Care Alternative. But they are within a skilled nursing facility. Some provide yoga, water therapy, weight training. Some specialize in HIV, and some nursing homes also provide hospice care. A rehabilitation agency, that's like Health South that you were mentioning early. If somebody has stroke or medical needs that they need a lot of intensive rehab services, they go to a Medicare place like Health South, and Medicare does cover those. Residential treatment facilities, you do have mental health issues and substance abuse issues in your parents or elderly people, and it's important to know that is in the whole spectrum of care as well. And skilled nursing units are based in hospitals. It's kind of like a nursing home, but you don't have to leave the hospital, but it's more for extended care, not permanent care. Okay, so we talked about a lot of those places. Again, 2013 statistics, this is just a financial comparison. Based on 2013, a nursing home with a private room. These numbers are produced from John Hancock, who is a long-term care insurance company. This is based on their numbers. The average was $94,000 a year, about $258 a day, to be in a private nursing home bed. A semi-private nursing home was $82,000. Not a whole lot of difference, between the two, private versus semi-private. And then if you were in an assisted living facility, that was running about $41,000 a year. If you look at the bottom, it shows you how much the cost was increasing annually, predicted to increase. Again, 2013 numbers. We've had the Affordable Care Act that has increased that number by how much the cost is increasing now, because there's additional compliance factors that facilities from home care agencies to assisted living facilities have to incorporate now. So at the time that came out. Over here on this side is the average national out-of-pocket cost for a home health aide to provide services, not 24-hour care, but in the home to keep someone there. So someone to come in and help with bathing, dressing, that type of thing, a couple times a week, was about $30,000 a year. And the average cost was at $19 an hour. And I think that average cost now with affordable care is anywhere between $20, $22 an hour nationwide. And little statistic that you save about $300 per patient if you have home care coming in, keeping the person in their own home, just in other costs, because you'll have less frequent hospitalizations or doctor visits because someone's there. That's just a statistic they threw out. So that gives you a broad picture of $300 per patient per year that you may save, because that's one less emergency room visit or something, because you have care in the home. Well, how do you evaluate those care options? That's a whole bunch of different places we talked about. There's home care. First place you can go to is floridahealthfinder.gov. You can compare assisted living facilities, skilled nursing facilities. You can compare drug prices. Prescription drug costs are huge, if you don't already know that from people that you're caring for. But yeah, you can also find physicians, facilities, providers, and what they compare on this website. They compare costs, you can see the inspection report scores, you can see if they've had any sanctions. It's a place to start in providing if you're looking at care. But I would definitely not use that as your only factor, but it is a place to start. When you're evaluating your care options, you have to look at the affordability. No doubt finances play a role in that. We saw some of the costs. The VA benefits, there are quite a lot of VA benefits, regardless of what you hear sometimes about the VA system, in the news. But they have a lot of the homemaker companion benefits that they start with. So if you have somebody who's eligible for VA benefits that you may think doesn't even need home care now, go start the process now. Because just to get through the paperwork, a couple months to do that. But then if they need just homemaker companion services at some point, VA is very generous with those benefits. And then it provides up to skilled care. Of course, they cross over with Medicare. But they will also pay for some of the benefits that Medicare pays for at the skilled nursing or physical therapy level.
Yeah, and it's also, it could be a spouse of a veteran. It doesn't have to be the veteran himself, because
Good point.
we applied for that for my grandfather, who was a veteran, and then my mother-in-law is a spouse.
Yes, so if, and I wanted to mention that, so I'm glad you did. Yes, so if you have somebody who is eligible for the VA benefits because they served, it is extended to the spouse as well, the benefits. So Medicare and Medicaid, of course, we talked a little bit about Medicare. Limited assets and income, Medicaid does have a lot of community-based health programs to keep people in their homes rather than sending them to a facility, because providing care in the home is cheaper for the government to keep people there rather than send them to nursing homes. So there's a lot of programs available based on your financial situation if you qualify for Medicaid. Long-term care insurance, I mentioned John Hancock, who's a long-term care provider. Interesting. Do any of you for yourself have a long-term care policy? 1 out of 4, right?
Not per se. I've got something tied into my life insurance.
Okay, that you can
for
borrow
if
against for
I'm
care.
Disabled early.
I've heard it's not a good investment until you turn about, I think there's a magic number of like 60 years old. Once you hit 60, then you need it. You get it at 40, the statistics show you're never going to use it.
You're spending a lot more money too. Here's the but to that. Because a lot of the patients that I care for in my business have long-term care policies. The long-term care policies that our parents may have bought 25 years ago, they're pretty good policies. They pay for a good amount of care in the home, 8 hours a day maybe of a home health aide, and they pay for homemaker companion services. But the long-term care industry has seen now that those policies are being cashed in, people are using that care. So the policies being written today for you and I, if we were to go out and buy a long-term care policy, you need to be a much more savvy consumer to look at what it's going to cover versus what you're paying for, kind of along the lines of what you mentioned. Because the long-term care insurance world has said, wow, those policies wrote 25 years ago when we didn't use a lot of home care, know a lot about it, just said, yeah, we'll cover all your home care needs at home, and that's very costly. So.
Sorry, I would need to get my daughter.
No problem, no problem. So long-term care insurance, if your parents have it, that's great. Something to consider for yourself too, to start looking at what policies pay now.
I'm ineligible.
Yeah, we have something that, yeah, okay. So, and of course, private pay, personal assets. The other 2 ways that you definitely should evaluate your care options are location. If you're thinking of a facility, which you've already used, is it convenient for family and friends? Is it convenient for social activities that your parents still may be attending? Can they go to church? A lot of facilities have transportation services included in them, so that's important. For my grandmother, who was in Clearwater, it was moving her to Tallahassee because her other daughter lived in Atlanta, at least to be closer to have people nearby. And facility specific. When you think you've got 1 or 2 facilities in mind that you're really leaning towards, you've heard good things from other people on the streets, go to that facility, visit it, look at the staff, talk to the staff, assess their friendliness, the smell of the facility, the appearance of the facility, the cleanliness, talk with residents that are there, talk with families, and really important, go at mealtime. Go at mealtime, you can ask to have a meal there with your parent, to taste the food, to see what they serve. But more importantly, there'll be other families there at mealtime, family members, talk to them. That's a really good time to get to know a facility, is to go at mealtime. And they let you do that. And then they all have a social activity calendar. Go look at the types of activities they're providing, if they're providing activities. Should be a wide range of different choices. So those are things to consider in evaluating your care. How do you decide on your plan of care? Well, these are some of the factors that go into it. Of course, the physical and mental condition of your parent or loved one is going to be first and foremost. If they're 100% immobile, that's going to limit where you can be. Mental conditions are important too. Is the mental state going to be declining? Are they Alzheimer's? Is it something that will determine where you can find care as well. Now, the hospital discharge planning process helps you with this. So if your parent is coming out of a crisis situation or a hospitalization, usually falls are the number one reasons that our parents end up in hospitals. It is required by Medicare. The hospitals provide discharge planning. They give you a list of agencies to choose from if they need skilled care at home through a home health agency. If they need to go to a facility, they provide a list of facilities, and they are supposed to help transition that care to make sure there's a plan in place before any patient leaves. Over the past 2 years, even more importantly to the hospitals, Medicare has put in a penalty, so to speak, for hospitals. So if you're discharged from a hospital and you come back to the hospital within 30 days from that discharge for any reason whatsoever, Medicare cuts the payment to the hospital from your first episode. So their job is to really make sure that you're going to leave the hospital, not come back in 30 days, that you have a good plan in place so they don't get hit with the financial penalty as well. That's something fairly new. Physician involvement, I skipped over short and long-term prognosis because deciding where you go for care depends on how long you think they're going to need care. Your physician has to be on board. Sometimes the best person to turn to is your family physician. This is important when parents are resistant to care because you're their child. They're not going to listen to you sometimes, like we didn't listen to our parents. I have a lot of families that will involve the family physician and say, hey, mom really shouldn't be driving anymore, but you need to be the one to tell her. So that's important. Your family physician can do that. But what's even more important with physician involvement is make sure that you are listed because of HIPAA laws. Every doctor that your family member has, that you're listed as a contact person and someone that can be shared information, because your parent may not think about that when they go for their routine cardiology appointment and they don't have you down, and then you have a sudden incident. Doctors aren't going to talk to you, and so it's real important to make sure that you have that information on record at all your physician offices. And then community resources. There is so much available in our communities. Next slide. This is just a small portion of where you can find help. On the local level, every area in the country has an area agency on aging. Ours in Florida is agingcarefl.org, and there is plenty of, they tell you what's available in your community, pages and pages of listings. Your senior center, we happen to have a great senior center in Tallahassee. It is wonderful. They have education programs, they have art classes, they have come bring your loved one for exercise. It's a great senior center. Meals on Wheels, you may need the services of a geriatric care manager, which helps you coordinate care if it's too overwhelming for yourself. Telehealth monitoring is something new, and our governor is appointed the first advisory council. You may think of it as the help I fall and can't get up button, but telehealth is so much more these days, and the governor's trying to get it paid for in home. So for example, medication regimens are the biggest problem too, people not taking their medicines on time. There's a telephone service that you hook up a pillbox dispenser to, and it opens up the pillboxes at the right time so that somebody can take their medications at the right time. So if you're not able to be there to give medicines to somebody. Support groups for every disease and diagnosis possible in town. We have a lot of support groups. On the national level, a bunch of national resources there, A.R.C, websites. There's all kinds of books out there. I mentioned one. It's called Elder Rage, How to Survive Caring for Aging Parents by Jacqueline Marcel. It's written with wit, humor, great tips on caregiving, but there's a ton of books out there. That's just one example. If you're interested, we have a Caregivers Weekly Newswire. It's just emailed to your inbox, and it takes all of the things that are in the news, in magazines, newspapers, television articles, and it culls them and puts them into one newswire. And I scrolled down from the October 3rd issue to the topic on caregiving, and these were the 2 items in it. Talks about meal service delivery options, and that was from an article in the Huffington Post. You just click on it, it takes you to that article. So instead of spending time trying to find everything yourself, I look at this every week and I'll find something in taxes and retirement, caregiving. And this practical to-do list for family caregivers, it was a Kaiser article that came out September 29th, really good as well. If you're interested, just give me your email address or email me your email address and you can have it. Hiring a caregiver, you can get one from a home care company, you can hire on your own, and these are the considerations. I'm not going to run through them all specifically, but you do have considerations to be aware of if you are hiring on your own. And these are things a home care company should provide for you. Next. Your turn. I've got some caregiving scenarios that I'm going to hand out here to get you thinking. 3 different scenarios, different types of caregiver situations you may find yourself in, and some thought-provoking questions to ask. If we had a large crowd here, we'd divide up and share our information, but here we are. So, and any questions? I'm here for any questions if you all have anything in particular.
Something very specific in Chipley, I heard there was a facility that were operated by the sisters that came from Poland. There's Polish.
Chipley's Washington County, right?
Yes, and I cannot. I saw an article on it in the Catholic newsletter that the diocese sends out, and this was like a year and a half ago. And I set it aside, but of course it got thrown out. So I cannot remember. All I know is it talked about Polish nurses, not nurses, nuns, that ran it and did it. And my mom's Polish, and I know she would thrive.
Oh,
if she
yeah,
could
in a
talk
community
Polish.
like that.
And I don't know how to re-find it. And I've looked under Chipley, I've looked under Washington County. I mean, I don't know who to call. I don't know how to
The 2 places I could suggest, the Washington County Senior Services Center, they have one. I think they meet weekly in like the agriculture building.
Okay.
We've done some stuff with them. So their executive director may have heard of it, may know of it.
Okay.
Or the FloridaHealthFinder.gov helps you locate facilities. So you can put in the county or the zip code. Now, I don't know that it'll say specifically it's run by Polish nuns, but you may find something in the name. I personally haven't heard of it.
I just was curious if you had heard.
I haven't. We have a location in Jackson County that covers the Washington County area. I'll ask my manager in that Marietta location if she's heard of it, because she's the one who actually goes to the Washington County Senior Center once a month, and ask her to ask around
What
too.
have you heard about Tapestry?
Is that the new one that's opening?
That's one new one over on Lake Shore. Where's the other one going to be?
That one was in the paper about 2 months ago, and they had an artist rendition, of it, and it's supposed to be huge. It's like 5 stories and really long. And that one, I thought was going to be off of Ox Bottom. I noticed they're building something now, but I think that's a residential on Ox Bottom in Thomasville, but somewhere back off of Ox Bottom. That one's like a year or 2 years out or something like that. But I remember seeing that in the paper, new one that's coming.
But Tapestry sent out postcards this week.
Yes. Is that the one on Monroe?
Lakeshore.
Lakeshore, Monroe area. Right. Don't know anything about them yet. I remember when some of the other facilities first opened, it's great to be in on the ground